Thank you, Mr. President. I yield the floor.
Mr. President,
The senator from Oregon.
I'm very pleased to be able to follow my colleague from New Hampshire, Senator Hassan. She said it very, very well, and this is an extraordinarily important part of the debate. The Senate vote on Trump Care is now days away, and that is the case even though the bill remains hidden in the Senate shadows. So I'm here tonight with my colleagues to try to shine some light on the extraordinary harm Trump Care is going to do to women's health across the country, and to also call on the American people to stand up and say loudly, this is wrong. Wrong because it would be a partisan process that takes away important health care rights from women across this country. First, Trump Care says that health insurance in America ought to be based on what men need, and what women need ought to cost extra. You look back a few years to when the Affordable Care Act set in stone guaranteed insurance benefits to protect everybody who shops on the open market, the private open market, regardless of their gender, no price gouging women just because they're women. Now, however, the Republican plan lets states hack away at those essential health benefits, and it always seems that maternity care is the first benefit that then gets cut. So if Trump Care goes through, what will happen in America is insurance companies will carve maternity care out of the plans they offer on the open market. It would, in effect, become an add-on that would come with a higher price, as if a pregnant woman's health care is a luxury item like a sunroof on a new car. So let's set aside the fact that every man in the country was born to a woman. My colleagues on the other side have spent 7 years telling Americans that they were laser focused on bringing costs down for everybody. But apparently, that notion of everybody that we're hearing from Republican senators doesn't include mothers, because their costs are going to be going up in a number of instances. Second, the public has heard time and time again that nobody would be hurt under Trump Care, and that repeal and replace was all about putting the patient at the center of care. Tell that to the hundreds of thousands of women who will lose their right to see the doctor of their choosing as a result of Trump Care defunding Planned Parenthood. Just unpack that for a moment. I think one basic, almost sacred principle for women is that they ought to be able to make the choice of the physician that they trust for their health care. And yet, what we're talking about here, apparently tomorrow, is a real prospect that women will lose the right to see the doctor that they trust. The ideological campaign against Planned Parenthood ignores the fact that there are already laws on the books that prevent tax dollars from funding abortions. It ignores the fact that Planned Parenthood doesn't get a dime of taxpayer funding above what's available to other comparable health care providers. It ignores the fact that women rely on Planned Parenthood to get routine medical care from the doctors they know and they trust. Basic checkups, cancer screenings, preventive care, HIV tests. It is long past time to end this crusade against Planned Parenthood, which is taking away from women in this country the ability to make their own judgments about who they want to see and the doctors that they trust. Finally, the Trump Care plan would significantly slash Medicaid. And this is a special threat to women. Medicaid is at the heart of women's health care in the country. Women live longer than men on average, and Medicaid helps pay for 2 out of 3 seniors living in nursing homes. Women are more likely than men to have a disability, and Medicaid is the key to helping millions of Americans with disabilities live successful, independent lives in their communities. The Republican health care plan would slash Medicaid so deeply, year after year after year, states would be forced to cut benefits and access to care. Women would be hit the hardest by those cuts. The public needs to know that right now it is go time in America on health care. This vote is right around the corner. And because my colleagues on the other side have in effect locked into this our way or the highway approach, the Washington word for it is reconciliation. My guess is in a lot of coffee shops in North Carolina and Oregon and points in between, people aren't that up on Washington lingo like reconciliation, but they really want Democrats and Republicans to work together. That's been the cornerstone of my work, Mr. President, with respect to health care. That's what Chairman Hatch and I have done with respect to the transformation of Medicare, to update the Medicare guarantee. I've worked with my colleagues in a bipartisan way in terms of independence at home, more care for older people at home, on a host of issues, particularly with respect to holding down pharmaceutical costs in a bipartisan way. The reality is that's the only way you come up with approaches that are sustainable, is to build on principles that both sides feel strongly about and lock it into a bipartisan, agreement. But what we're looking at, again, not in 6 weeks, but tomorrow, is the Senate Republicans saying, we're going to use this reconciliation, not the bipartisan approaches that I think yield the real dividends, but a partisan approach. It's called reconciliation. It means it's our way or the highway. And then what you're going to do is you're going to have one of the most consequential debates about domestic policy in decades. It's just going to fly through the Senate with hardly any public input and debate. So a big part of what I wanted to do tonight is to come to the floor of the Senate to say to Americans, this is the time to get loud, to get very loud, and to tell your friends and your neighbors and your relatives to get out there and be loud with you. This isn't some mundane debate where the two sides couldn't square their differences, the kind most people choose to ignore. This is an out-and-out attack on the health care of millions of Americans, and especially women. I think when the facts get out to women in this country, they're going to say this is wrong, and they're going to say this is personal. The people in Washington, D.C. talk about lots of things and throw around lots of Washington lingo like reconciliation. But I think they're going to see through exactly what these proposals mean for them. And it is a significant rollback of their rights on matters like being able to choose the doctor they trust. My own view is, Mr. President, I'll close with this, and I've felt this way since the days when I was co-director of the senior citizens at home in Oregon, is that political change hardly ever is top-down. Top being it comes from government buildings and then trickles down to people. It is almost always bottoms up when the voices of Americans are heard and they tell their elected officials when they're off base, when they're doing something that will hurt them rather than help them. So I close by way of saying that I hope this has provided at least some useful information so Americans, particularly women, can get engaged, get loud, and do it now. With that, Mr. President, I yield the floor, and I would note my colleague from Connecticut is prepared to speak.
Mr. President.
Senator from Connecticut.
I am proud and honored to follow my colleague from Oregon, who has been such a steadfast leader when it comes to our nation's health care and insurance, and particularly when it comes to women's health care. I've been really proud to stand side by side with him and Senator Murray and other colleagues who have been here today. And I must say, sometimes on the floor of the Senate,